Okay, acute arterial ischemia. So if you have acute blood flow, no oxygen or very low oxygen, this is usually caused by an embolism, or it could be caused by plaque. But basically, if you're not getting blood flow to your extremities, the most common would be your feet and legs, you would have certain symptoms that you would see. And so here are 6 P's of symptoms. You would have pain because blood flow is and oxygen is not getting. So like claudication or just pain from no oxygen. Pallor, it's going to be pale. Pulselessness, or very minimal pulse. You might have to use a Doppler. Paresthesia, pins and needles feeling. Paralysis, meaning no movement. And then poikilothermia, which is a fancy word for meaning if you don't have enough blood flow to that extremity, it becomes cool and it takes on the temperature of the ambient air around it, so much cooler. So these are the 6 P's for arterial ischemia for a patient. So treatment. We can do anticoagulation that'll help blood flow, so Plavix, aspirin, warfarin. We could do thrombolysis, so urokinase, streptokinase, retivase. So dissolve the clots. You could go in and take the clot out, embolectomy. You could have surgery. If you can't ever get fluid going, then you may have to amputate, or surgical revascularization, putting a stent in the artery, doing a plasty, doing a bypass. Raynaud syndrome. Raynaud syndrome is basically when your fingers and toes vasospasm. This is a very common thing for some people. It could be from other diseases, could be from systemic lupus erythematosus, could be from scleroderma, other things. If it's from another disease, and it's called secondary Raynaud's. So what happens is your arteries, small arteries, clamp down, they spasm, causes change in color of your toes and fingers. It may be pale, blue, reddish color. It can be painful. So it can happen in healthy women, is usually the most common. Other things that bring it on: stress, tobacco use, cold will do it. They don't really know why it happens, but it just does for some patients. Treatment for this basically is it does usually go away, but you're going to have the pain and sensation of cold. It's going to be not feeling very well, so these patients will probably, some things they'll do is soak their fingers in warm water. They'll wear gloves, especially in the winter, so they don't feel cold. So wearing a couple pairs of socks, different kind of things. So calcium channel blockers are the #1 thing that relaxes smooth muscles and helps stop the spasming. Not all patients that have Raynaud will be on a calcium channel blocker. Just depends how severe it is. Some are, some are not. Here's a picture of Raynaud's. Notice white fingertips. Here's they're really white. So venous disease. Now what we've talked about now are arterial diseases. Let's talk about venous disease. Venous diseases in your periphery, basically, you have valves in all your veins that move the blood up. So the valves are there because if they didn't have valves to move blood up and then close, you would have pooling and retrograde of flow in blood by gravity. So we have all the valves in our veins to move things up. So venous diseases could be caused by low pressure in the veins. They're very thin-walled. Could be caused by just problems with someone smoking, having hypertension. Diabetes for years is also going to take its toll on your veins, as it does the arteries. So deep vein thrombosis, these are in the veins, not the arteries. So you get a clot formed in your giant veins in your calves. And the big problem with this is these can move. If they move, it goes to the heart, lungs, and brain, could cause a stroke. Patients die from this. So who is predisposed to having DVTs? Well, prolonged bed rest, patients that have been in long surgery, patients that come back from surgery and now are on bed rest. If you have vessel wall damage, that endothelial cell are also. Patients that have hypercoagulability of the blood, so they're dehydrated, they have blood diseases. There are patients out there that are just prone to have DVTs. They're just very high risk factors. There's some certain diseases, genetic diseases, that patients just clot more readily. There's not a thing you can do about it. It's just going to happen. So signs and symptoms, obviously, is you would have pain sometimes in those lower extremities, calf pain. If you have calf pain with dorsiflexion, it's called Homan sign, but not all patients that have a DVT have a positive Homan sign. I think it's only about 40% of patients with positive DVTs that have a positive Homan sign. You would have a D-dimer would be increased, because D-dimer basically is showing if clots are being broken down, so that would be elevated. You might have edema, might have redness, heat, tenderness in that calf or wherever it is. So complications, obviously, if the clot moves, goes to your heart, lungs, brain. The other thing that can happen is you just are going to have chronic venous insufficiency, meaning your venous blood return is going to be diminished. So treatment, heparin, Coumadin, bed rest. If someone has a lot of DVTs, they could put in a inferior vena cava filter to trap those. One of the brand of that is a Greenfield filter. Here's what the filter looks like. It sits right in your venous cava, and it traps clots as the blood flows through. Varicose veins. Varicose veins are dilated or tortuous vessels. Usually it's because the valves are not working, so your blood pools. It can lead to clots in your varicose veins. So it's basically prolonged dilation, stretches the vessel. This is usually caused by trauma to the veins. Could be too much standing. So if you have a job that you're on your feet all the time, like a nurse, you may be prone to varicose veins. Obesity, pregnancy can cause it. It's usually an asymmetry vein in your leg. So you can tell if you have these because you have that venous engorgement in your veins. You can see it. It helps if you elevate the limb, but if you're in a job that you can't elevate your limb very much, it's going to have pain on walking. So treatment, well, you can wear elastic stockings. Ambulation helps. Leg exercises. Warm, moist extremities. Warm, moist packs on your extremities where it's happening. Or you can do surgery and strip those out and fix them. So, elastic stockings for those that are on their feet are probably the best. Here we go, some really horrible views of varicose veins. Venous stasis ulcer, chronic venous insufficiency. Now, you can have ulcers on your extremities. They could be venous ulcers or they can be arterial ulcers. Venous or arterial, two different things. Keep in mind everything we're talking about. You have arterial problems and venous problems. So when you hear someone say, I have an ulcer on my foot or leg, is it a venous ulcer or is it an arterial ulcer? So what can we do to prevent ulcers? Well, we can have the patient wear compression stockings. The skin gets really dry, breaks down. We can do lotions, daily moisturizing. People that are prone to having ulcers, they should avoid standing and sitting. long periods of time. Legs should be elevated above the heart so you can keep the blood moving. So if legs are down, then you have, if you're in a dependent position, you've got your knee bent, so the blood is going to have a hard time flowing down and flowing up. So the best way is having your legs elevated above your heart for the most period of time. That is hard to do for most patients.